You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's episode, we will be talking about splinters and foreign bodies. Now, what is a foreign body? Well, a foreign body is a medical term. It describes anything that isn't part of your own body or something that's in a part of the body where it doesn't belong. Foreign bodies can be splinters. Splinters just happen to be a general term, but foreign bodies are oftentimes metallic. They could be made of plastic, glass. They could be something natural, such as wood products. They could be something made in a factory. They could be something that you're still not quite sure, even after you've looked at it, because it could be contaminated. There could be debris, rust, many other causes. So a foreign body is anything that doesn't belong in the body itself. Now, why do we worry about foreign bodies? Well, a couple of reasons. The first thing is pain. So if you are doing some woodworking around the house and you get a splinter, which is a type of foreign body, naturally you want to remove it. The reason is that it can cause complications, including bleeding, infection. It can cause festering and some other irritation. So splinters are one type of foreign body. Now, other foreign bodies occur, for example, through industrial accidents. So if something explodes, maybe someone is working with a glass environment, maybe they're washing dishes and shrapnel or pieces of glass are embedded in the skin, those have to be removed before stitches can be placed. The reason is that you don't want to put stitches over a contaminated wound because the wound won't heal properly. Foreign bodies cause a lot of irritation. They cause swelling, pus, they can cause a lot of pain, and as the scar grows over a foreign body, it causes stretching of the skin. Many people feel unnerved by that. They don't like the way it looks, they don't like the way it feels, and so whenever people come into my emergency department or to any ER or urgent care, the first thing that we always recommend is that we have to cleanse the wound thoroughly. Now, when people are at home, oftentimes they want to just pull it out themselves. They feel like, oh, I know where it is, I see what's going on, I'm just going to go ahead and do it without going to the doctor. The dilemma is that these are always underestimated. So, for example, if someone has a splinter, they think it's maybe 1 inch long, they want to go in and pull it all out. The dilemma is that you don't know if you've gotten all 1 inch of it. There's a chance that it could have broken off. There's a chance that there may be half an inch still under the skin, and now you will not be able to reach it. Glass is particularly notorious because a lot of people underestimate the sharp edges of the glass and the fact that there may be multiple splinters or shrapnel of glass that can go in different directions. There were several studies done, and one of the studies indicated that only about 4% of glass was visible in the emergency department by a trained doctor looking at a wound, recognizing what they had to do. Only 4% were able to pick that up. When you add x-rays, it increases between 7 to 21%. Glass has a little bit of a shadow that will show up on x-rays, and so it is recommended that doctors order x-rays if there's a chance that there's glass or multiple pieces of glass in a contaminated wound. Now, the things that do show up on x-rays very easily include metal. So anything metallic is very easy to identify. Even someone who's not a physician would be able to look at an x-ray and point out something that's metallic. You can see the exact shape of it, any edges to it, or multiple foreign bodies in that area. Other things that are harder to detect are things like plastic, oftentimes from toys that children play with, or sometimes if someone is throwing out the trash, or someone might be opening a package, maybe it has that very hard, very stiff type of plastic material on it. Oftentimes those will also become embedded in a wound, and that may not show up very well on x-rays. The dilemma is that as the wound is trying to heal, if the foreign body is still in there, it will fester. And after a few days, even though there may not be pain initially, 90% of those times, those people end up coming back, either to the emergency room or they go see their family doctor, and they say this is just not healing the way it's supposed to. And in those cases, that wound has to be probed, meaning it has to be opened up, it has to be examined under careful consideration to make sure whatever is there is actually removed properly. Now, again, as I mentioned, a lot of people try to do this at home. The dilemma is that you don't have pain medication at home and you don't have a lot of the tools at home in order to be able to remove it. Now, what can you do at home if you have a foreign body and you don't want to go to the emergency room or you don't want to go to the urgent care? The first thing I always tell people to do is soak it. So you can first run just regular tap water, either warm or lukewarm tap water, over the wound, and that'll help to soften the skin. If it's something easy or metallic, it'll hopefully work its way up towards the surface. Now, if that's still causing problems, then you need to be seen by a doctor. Whether it's your doctor, an urgent care, or an ER doctor, they need to actually look at it, and then they will advise you on the best options for removing it. They may do an x-ray if it's something that'll show up on an x-ray, but most of the time what they'll do is numb it with a small amount of lidocaine or some other anesthetic, and then again they have to probe it. Now, the way that I typically do that is I'll numb the area around, usually about a half inch or an inch around it, and then we will take a scalpel, just a very sharp edge scalpel, and not cut the skin, but we tease it. Meaning, for example, if you think there's a piece of metal that's embedded in there, we'll use the scalpel not to go deeply, but just to separate the top layer of skin. And in those cases, if the metal or other fragment is there, it actually pops up to the surface, especially if you've been soaking it for a while. And that's very easy to remove because we have special tweezers or forceps. We can grab it, remove it completely, and then do an x-ray to confirm that it's gone completely at that point. And if there is some bleeding, we can easily close it with some stitches, and the patient will be much happier with the outcome. Now, let's say somebody comes into the ER, we do the x-rays, we're still not quite sure, we've done the numbing, we've started cutting, we just don't feel where it is, we've gone a little bit lower, a little bit deeper, and now they start bleeding. What do we do at that point? Well, we actually have to stop because you can't see anything through blood, and in those cases we'll have to stop at that point. We'll do a dressing, basically gauze wrapped with some tape, and then I usually make a phone call to either a hand specialist or a foot specialist or a dermatologist, someone in town that I can refer that patient to. In that situation, they'll give it a day or two, and then they'll be evaluated in the office, and then they'll have to do a deeper procedure. So in those cases, those specialists are very trained. They have a lot of tools and other techniques at their disposal, and they can go deeper than the areas that I can typically go safely in the ER. In those cases, they will probe down to the muscle level. They'll make sure the nerves and the ligaments are healthy, and then they'll remove whatever might be there, still causing any issues. Okay? So at home, if you have a foreign body, the first thing to do is not to try to pull it out. It's actually to cleanse it. Simple tap water is fine. You need to soak it for a little bit, soften the skin, and see if it will come up to the surface. If it doesn't, don't squeeze it. Don't mess with it. Don't try to do anything on your own. Go to the doctor. Let them take a look at it. Let them try to numb it, and then remove it with any basic tools, scalpel, forceps, tweezers, things like that. If there's any concerns, then I would definitely go to a specialist, whether it's a hand specialist in the fingers, if it's in the foot or the toe or the heel, then I would definitely go to a podiatrist, which is a foot doctor. Now, we talked a little bit about some of the complications with infections. The worst case scenario is that the infection will be seeded, meaning that if there's bacteria, they actually go deeper. So not just the skin or the soft tissue, but they want to go all the way down into the tendon, into the bone, or even deeper structures. So a bone infection is called osteomyelitis. So osteomyelitis, due to any bacteria, is a very, very bad thing. That will require at least 6 or 8 weeks of antibiotic therapy through an IV, meaning oral antibiotics, pills, creams, injections don't work. You have to be on almost 2 months of IV antibiotic therapy at high doses, otherwise the bone will be permanently damaged and amputation is likely. So we take these infections very, very seriously. So osteomyelitis is a complication from splinters and foreign bodies. It's much more common in people who are diabetic or people that have other circulation problems. But truthfully, it can happen to anyone. It could be a child, it could be a teenager, it could be an athlete, it could be someone who's been doing all kinds of activities and very active around the house or at work. But once the infection goes that deeply, then we have to treat it as aggressively as possible. Now, there's another category of foreign bodies, which is usually swallowed. So those are ingested, meaning little children or even older children or adults, they'll swallow things like coins or button batteries or toy parts or screws, marbles. These are common things that are around the house. those things we always have to get x-rays for. So if a mother or a father brings in a child, maybe they're 2 years old or 3 years old, and they don't know exactly what happened, or the child won't tell us what happened, then we do an x-ray to make sure that the foreign body is basically where we think it is and not anywhere else. For example, if someone says they swallowed a coin, which is the number one most common foreign body ingested by children, so any kind of coin, whether it's a penny, dime, nickel, or something else, that is the number one foreign body that's ingested. Oftentimes on an x-ray, we'll see it in the esophagus, meaning the swallowing tube, or it's already in the stomach, and it can transit very rapidly. So over 90% of these cases are actually mild, meaning people who come in, they're worried their child swallowed a coin, they're breathing fine, they're laughing, playing, walking, and so forth. Those are reassuring. Those people are going to be just fine. It'll take a couple of days for them to pass it through the intestine and then out in the stool, but we generally don't need to do any type of surgery on that. Now, there are cases where we have to worry. So there's things like button batteries. So batteries from watches or small toys, they have toxic chemicals. So if a child happens to put that into their mouth and they swallow it, that can actually cause necrosis, meaning skin breakdown, burns, or perforation, which is basically a rupture of the skin on the inside of the body, and that's a surgical emergency. So if we know it's a button battery or anything with any type of chemical in there and it's been ingested, we make a phone call to our GI specialist or surgeon. Those people are not going home. We have to admit them to the hospital in order to remove it. Now, some things are unusual, so things like magnets. Magnets can come in all different types, and there's magnets connected to a lot of different objects that you don't even worry about normally, but children have a habit of picking these things off. So if you have a magnet or a group of magnets on the refrigerator, children tend to take them apart, and they'll swallow multiple magnets. The dilemma is that when multiple magnets are in the intestine, they can actually attract each other. And now on the inside of the body, you've created a situation where nothing's going to move. So the stomach and the intestine and the normal digestion is trying to occur, but the magnets are holding onto each other. And this can again cause a perforation. It can cause a lot of complications. And so oftentimes magnets have to be removed surgically because they may not pass on their own. And then there's all kinds of other things that people swallow. Some of them do so because of a dare or a bet. Some people have psychological issues. They may have OCD or some type of compulsions, so they'll swallow things that just don't make sense. And those people usually have other underlying issues that need to be addressed. But for the most part, when we see people with foreign bodies, we do our best to clean them, remove them, treat them, and if not, then we'll either admit them or arrange for outpatient follow-up with their specialist. Now, in terms of the prevention of complications, there's a couple of things that we do recommend. Tetanus vaccination is recommended in all puncture wounds or any kind of contaminated wounds where the person is either out of date or they're not sure when they had one. So tetanus generally is a bacteria that grows outside. So it can be on dirt. It can grow on a farm. It can grow on metal, rust. It can grow on tools. It's just one of those very hardy type of bacteria. It can grow just about anywhere. So if someone tells me they were in their garden or they were in their front yard or they were at a mechanic shop and they have an injury, we need to ask, when was your last tetanus vaccine? Tetanus vaccines are good for at least 5 years and up to 10 years for most healthy people. So if somebody says, well, I'm an adult now, last time I had a tetanus booster was probably my first year of high school, they're probably due for a tetanus booster. There's a couple of different tetanus boosters out there. The one that we generally recommend now is called a Tdap, so TDAP, Tdap. The benefit with this tetanus booster is that it includes the pertussis, or the whooping cough vaccine, because we are seeing an increase. There's an epidemic of whooping cough nationwide, so the tetanus and the whooping cough vaccine are now combined, so we do recommend that one at least once as an adult to protect against both tetanus and the whooping cough. So it's something that doesn't make a lot of sense initially. Why are you treating me for whooping cough or giving me the vaccination for that when I'm here for a puncture wound or some other injury? But it's actually to prevent complications down the road. So between 5 and 10 years, if you've had a tetanus vaccine, you're probably current. But if it's been outside of that 10-year window, you need a booster at that point. So I hope you learned a little bit about the different types of foreign bodies, some things that will show up on x-rays, some simple techniques you can try at home, and then the reasons that you should be seen in the ER or by a specialist if there's any complications. You can listen to our blog online and learn more information about that. And I thank you so much for joining me today. I look forward to having you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.